The Substance Abuse and Mental Health Services Administration has a definition of recovery and recovery-oriented care, and they talk about it as being a process of change through which an individual lives a self-directed life. They advance their health and well-being so they can achieve their goals in life. Part of the message to me in that is that we are all able to change at any point in our life, and we can do that by working with other people, asking for help, and that may be all that it takes is that willingness to raise your hand, to pick up the phone, to walk into a clinic, to say something to someone and say, I don't know what to do, can you help me? And that's all that it takes.
The brain is not something different from the rest of the body, and the brain is what provides the foundation for one's mental health or lack thereof. So it's really important, as we understand the brain better, to remember that that's what's causing the mental health conditions, or at least underlying them. You may have heard of bipolar disorder, of schizophrenia, and other related conditions. And it's those populations which at times in the past were thought not to be able to recover past a certain point, that we now have a better understanding through improved therapeutics or drugs with fewer side effects, so they're better tolerated, with more focused evidence-based psychotherapies, and with an understanding of what's required in the environment in order to keep people stable. Recovery is really based on a recognition that the old assumptions that you couldn't get beyond a certain level to have a quote normal unquote life is really not valid. That we can, but it's a group effort. People have to buy into this is important to do. So successful recovery involves incorporating all of those ideas at the individual and also systemic level.